Hi, I'm Dr. Becky Stout, Associate Dean of Nursing Student Education with the Geisinger College of Health Sciences. I'm here to tell you about the Clinical Faculty and Preceptor Academy, or CFPA. It's a new and exciting resource for new clinical faculty and preceptors to learn the essentials of clinical teaching, or for seasoned clinical educators to brush up on teaching strategies and topics critical for today's clinical environment. The CFPA was born out of a Health Resources and Services Administration grant. Geisinger received $4 million over 4 years to create, test, and run an educational resource for training clinical educators. So, why the CFPA 101? And why are we excited to give this to you? This is an opportunity to learn best practices for educating our future colleagues and produce a strong nursing workforce while also gaining great professional development education that will also help in your day to day activities. As you know, the nation has been experiencing a severe nursing shortage. This includes a shortage of nursing faculty. Without nursing educators, enrollment to schools goes down, and we can't graduate the nurses we so desperately need. The CFPA is our opportunity to make a difference in the nursing shortage, in the quality of clinical education, in patient care, and in professional development and job satisfaction. An essential part of the CFPA's success is our partnership with the Pennsylvania Action Coalition, a program member of the National Nurse-Led Care Consortium and an affiliate of Public Health Management Corporation. The PA Action Coalition, which was established in 2001 to guide implementation of the National Academy of Medicine's report, The Future of Nursing, Leading Change, Advancing Health in Pennsylvania. Our work together achieves both our organization's goals. Through a year-long consultation with an advisory board that consisted of nurse leaders from healthcare institutions, esteemed nursing programs, and frontline practicing educators, we developed an online asynchronous course called the CFPA 101 Fundamental Concepts for Clinical Faculty and Preceptors, which is accessed at the Geisinger School of Nursing website. So, what makes this program special? Why should you consider the CFPA 101? First, it's the content. We've created 6 essential learning modules: basic principles of teaching and learning, effective professional communication, elements of teaching strategies, fundamentals of assessment and evaluation, transition to novice educator role, faculty identity formation, and emergency and disaster management principles on nursing education. Across all these modules, we've interwoven horizontal threads of DEI, legal and ethical concerns, crucial conversations, generational differences, and wellness through self-reflection, introspection, and self-analysis. The second reason to consider the CFPA 101 is the course design. We use interactive, unfolding, longitudinal case stories throughout the modules so you get to know the characters within real-life situations. The technology was developed in-house, and it was important to us that the modules are fun and engaging and not boring PowerPoints to click through. Finally, it's the quality of the program. Our objectives align with the National League of Nursing's Academic Clinical Nurse Educator Certification exam. We piloted the program for a year at Geisinger, and using Kirkpatrick's model for evaluating training outcomes, our data shows that people really enjoy the program, that the content is on target for their needs, and they are satisfied with the overall course structure and format. We've also had great feedback directly from people who took the CFPA 101. Some are seasoned educators, like Deb Erdman, who has been a nurse for more than 20 years and who shared that the scenarios were real and she would have loved to have taken such a course when she started. And we've heard from new nurses, like Madeline Paterick, who was struggling as a novice preceptor until our course helped her find her footing. Starting October 2024, the CFPA 101 will be free to any LPN and RN in the HRSA Region 3, and the grant will continue to cover the cost until October 2026. This means it will be free to any nurse at a healthcare institution or school of nursing in Pennsylvania, Maryland, Delaware, West Virginia, Virginia, and the District of Columbia. For more information or to access the CFPA 101 starting October 1st, 2024, just scan this QR code or visit the Geisinger School of Nursing website. The CFPA 101 takes about 10 hours to complete, and at the end you'll get a certificate of completion from the Geisinger School of Nursing. and the opportunity for 10 CE credits from the ANCC for only $15. That's a steal. We appreciate that you are choosing the CFPA to enrich your career or the careers of your staff or faculty, and for seeking to elevate the education of the students you teach. And thank you for choosing Geisinger to be part of your journey.